everyone, and welcome to today's webinar, an introduction to the new Vineland 3. My name is Valerie O'Keefe, and I'm one of the consultant psychologists at Pearson Clinical, and I'll be hosting today's webinar. What we'll cover today is what's been updated in the Vineland, and how has the structure of the Vineland changed, what materials are available, what are the new form options, paper pencil versus online administration and scoring, which results in the Q Global reports. And we'll also look at the Vineland 3 standardization and the psychometrics. The Vineland has been around for very many years, originally called the Vineland Social Maturity Scale, which first published in 1935. What we've been using up until recently is the Vineland Adaptive Behavior Scales 1 and 2, and then now the 3, which published last year in 2016. So there are decades and decades of research behind this tool. So why do we use the Vineland 3? The main uses of the Vineland 3 include diagnosing developmental delay, intellectual disability, and autism spectrum disorder. The results are often linked to special education placement or funding and NDIS eligibility and funding, intervention planning, progress monitoring when you're measuring someone's progress in the areas of adaptive behavior over time, and also assessing independence and self-sufficiency in a variety of settings, which can include working with older adults. In relation to intellectual disability, the DSM-5 gives us the criteria for intellectual disability diagnosis, which relies both on cognitive impairment, but also deficits in adaptive functioning, which includes communication, daily living skills, social participation, and independent living, which are all areas that are assessed by the Vineland 3. And the severity levels for intellectual disability now are really more focused on adaptive functioning rather than an IQ level. And this is a bit different than the DSM-4. So differentiating cognitive ability or IQ from adaptive functioning. Cognitive ability generally defined as a person's repertoire of problem-solving skills and their knowledge. Whereas adaptive behavior is more the performance of skills that are necessary for personal and social sufficiency, those daily routines. Let's have a look at some Vineland 3 updates, including the new materials. There's now 3 different types of forms in the Vineland 3, which is an interview form, a parent-caregiver questionnaire, and a teacher questionnaire. We've removed the words rating, survey, and expanded. Each of these 3 types of forms has a short and a long form, which is called the comprehensive form, which is the long form, and the domain form, which is the shorter form. We have 5 domains: communication, daily living, socialization, motor skills, and maladaptive behavior are now available on all forms, but are optional. The maladaptive behavior used to only be on the parent form. This is now on the teacher form as well. Those domains are broken down into subdomains. The gross and fine motor skills are optional, and they're normed on birth up to 9 years. The maladaptive sections include internalizing, externalizing, and critical, and the other section for maladaptive has been removed. The Vineland 3 materials have a new look and feel. This is a look at the new Vineland 3 manual, and the record forms are also new and revised. There's 3 interview forms, a long form called comprehensive. The comprehensive form also comes with or without item level probes, depending on how comfortable you are coming up with your own interview start points and questions, and a short form for the interview. There's also the parent-caregiver questionnaire forms, which the parent and caregiver complete themselves, short and long forms, and then the teacher questionnaire, which is also an independent questionnaire, short and long forms. So as you can see, there's actually 7 forms to choose from when using the Vineland 3. The Vineland 3 has scoring pages built into all of the hand-scored record forms, which we just saw. So everything can be hand-scored, and the normative tables are available as a PDF. But everything in the Vineland 3 can also be administered online and scored online through the Q Global platform. So although hand scoring can be done, it does take a little bit longer than simply putting in the scores to Q Global platform and generating a report. So the Q Global platform allows users to administer the assessment in 3 different ways. You can do a manual entry, which means you've administered it using the paper pencil form, and then you put the scores into Q Global for scoring. You can do an on-screen administration, which means that you administer the assessment on the computer screen of any internet-enabled device, or remote on-screen administration, which means that you're emailing a link to a teacher or a parent through the QGlobal platform, and they can do the questions on their own device, in their own time, in their own setting. So in summary, hand scoring, you can administer via paper and score via paper using the norms that are available in the PDF. You can do a hybrid, which means you could administer it via the paper forms and then data enter the results into the QGlobal platform so that you can generate a report. Or you can be completely green, all digital, meaning you're administering it on QGlobal on the computer, and the computer then generates the scores and the report for you. If you are using QGlobal, the computer will automatically keep track of any starting points, reverse rules, the basal, the ceiling, and the stopping rules. You can do the interview form using QGlobal as well. You're simply reading the questions and talking about the questions to the parent from the computer screen as opposed to a paper form. And the computer will organize the items into content and topic. We'll have a closer look at QGlobal, how it looks, what the report looks like, as well as pricing in a little while. Many users of adaptive behavior assessments know that they can be time-consuming. So I've put up here a look at how long does it take to administer the new Vineland 3. You can see here that the administration time depends on the age of the child, but also if you're administering a long, comprehensive form or a shorter domain-level form. So what you see up here are minutes. For example, if you're using a domain-level parent-caregiver form, it takes the parent about 10 to 15 minutes to complete the domain form, which is the shorter form. If they're doing the motor skills section, which is optional, you would add on an additional 2 to 3 minutes, and the maladaptive behavior, again, an additional 2 to 3 minutes. So the overall time would be estimated at about 20 to 25 minutes. The interview forms, especially for younger children, can take longer. Look at the updated content and structure of the Vineland 3. The Vineland 3 items were updated to reflect changes in daily living, and a lot of this is around new technologies and also in relation to conceptions of developmental disabilities. For example, there are more questions that are designed to help assess adaptive behavior in children who have autism, because we know that is a higher incident area now than maybe 10 to 20 years ago. The outdated items have been dropped or modified, and the items are more general in their wording, and this allows for more cultural differences to be accounted for. For example, the question understands what direction his or her language is written in has replaced a question that is understands that language is written from left to right. So it's not about knowing it's from left to right, it's knowing what direction his or her language is written in to allow for more cultural differences. Another example, responds politely when given something. This is more general than says thank you. Saying thank you may or may not be the cultural preference. So a more general question is used instead. Another example, we know that eye contact, for example, differs for various cultures. So the question is more general, maintains culturally appropriate eye contact during social situations. The structure of the Vineland 3 is similar to the Vineland 2 with some changes. The domains include communication, daily living, socialization, motor skills, and then maladaptive behavior. And these are broken down into subdomains. The communication area is broken down into receptive communication, so attending to and understanding and responding appropriately to the information from other people. Expressive, which is using words or sentences to express oneself verbally. This would include some nonverbal communication as well. And then the higher level area of written communication, which is basic reading and writing skills. The daily living skills domain is broken down into personal skills, which is really those basic skills around eating and dressing and washing, hygiene and healthcare. Domestic skills, which is cleaning up after yourself, doing some basic chores, food preparation. The numeric, which is on the teacher form only, is using numeric concepts in a practical way like time, calendar use, money use, for example. The community subdomain is on the interview parent and caregiver form only. And this is really about your functioning in the world outside of the home. So it's about getting yourself around the community safely and accurately, being responsible in the community. School community is on the teacher form, and that's that self-sufficiency and showing appropriate behavior in the school environment. The socialization domain is about your interpersonal relationships, so that's responding to and relating to other people, including friendships and caring, being able to hold a conversation, being appropriate around other people. It's your play and leisure time, so being able to engage in play and fun activities with yourself, but also with other people. And then coping skills. So being able to show coping skills and emotional control and a bit of cognitive flexibility when a different situation comes about, for example. We also have the motor skills domain, which is optional, and that's broken down into gross motor. So this is the large muscle movements, arms and legs for movement and coordination. And then the fine motor skills, which is more fine motors in using hands and fingers to manipulate objects like a pencil or scissors, for example. And the motor skills domain is normed from birth to 9 years. It's optional, but it can be very useful to administer to individuals of any age which have some known motor deficits. So although the normative scores are available up to 9 years of age, you can administer the questions for older individuals to get more of a qualitative idea of any motor issues that are impacting on self-sufficiency. Also, the motor skills domain no longer contributes to the ABC, the Adaptive Behavior Composite. It is considered a separate domain now. The Maladaptive Behavior domain is something that you'll find on the Vineland 3, but not all other adaptive behavior assessments on the market. So the Maladaptive Behavior domain is available now on both the teacher as well as the parent form. And what it is measuring undesirable or atypical behaviors that can interfere with adaptive functioning. It's available for ages 3+. All items are administered. There's no basal or ceiling. And there's 3 main areas of adaptive behavior. Internalizing, so this would be behaviors related to anxiety or depression. So for example, hiding, maybe biting fingernails, self-harm. Externalizing behaviors, for example, disruptive behavior or acting out or being aggressive. And then critical items as well, which are those very serious items that need to be addressed immediately. High levels of aggression, suicidality, self-injury. Let's have a closer look at the new Vineland 3 forms, because there are quite a few to choose from. There are 7 forms to choose from, 5 for the parent and 2 for the teacher. In the first column here, you'll see the interview forms, which are used with the parent. This is what used to be called the survey forms. We've removed the word survey, just called interview form now. The comprehensive interview form gives you 3 domains, 9 subdomain scores, plus your overall adaptive behavior composite. It also gives you the 2 optional areas of motor skills and maladaptive behavior and can be used with birth up to 90 years plus. There's 502 items. However, there is a developmental start point, a basal, and a ceiling rule, so you'll never be administering all 500 items. The domain level form for the parent is also an interview form, but it's shorter. You only get the 3 domain scores and the overall adaptive behavior composite score. You do not get the subdomain scores. You do get motor skills and maladaptive behavior, and it can be used with ages 3 up to 90. And there's 195 questions, but all questions are administered. Also note that the comprehensive form has a lower start point. It starts at birth as opposed to age 3. So developmentally, the questions on the comprehensive form have a lower floor, an earlier developmental start point. So if you are working with a child who's even 4 or 5 or 6 years old or older, but who is functioning below the 3-year-old level, It's probably a good idea to use the comprehensive form. It has a lower floor and starts at a lower developmental level. It will also allow you in your scoring to get age equivalent scores down to 1 month of age. If you use the domain level form, the age equivalent scores that you can get will only go down to 3. The parent caregiver form is the questionnaire that the parent or caregiver completes themselves. And this is a good option for parents who have good literacy skills and have the time and responsibility to do the questionnaire themselves and to bring it back to you. The comprehensive form gives you all domain, subdomain, and overall ABC scores, your motor skills and your maladaptive scores, and it also gives you that very low developmental start point and the very low age equivalent scores down to birth. 502 questions, but there are ceiling items, so you won't do all 502 questions. The domain level form gives you the 3 domains, but not the subdomains. All other scores are available, but just note that the developmental age starts at age 3. The teacher form, there's a short form and a long form. The short form, the domain form, does not give you the subdomains, but everything else is available. And both of these teacher forms start at age 3. Now, the Vineland 3 interview form is designed so that the interviewer does not read the items to the respondent. What the interviewer does is use open-ended questioning to prompt the respondent to talk about the examinee's behavior in a particular area. The open-ended questioning is used to help develop a conversation with the parent, for example, around a particular topic. And then the interviewer decides the rating based on the feedback from the parent. This is different from the parent and caregiver questionnaire form where they read and do the ratings themselves. The interview forms include a comprehensive interview form with or without item level probes, which I'll show you in a moment, and then a short interview form called the domain level form. If you need to develop an intervention for a child who's a very low functioning level, it's probably best to do the comprehensive form. It will give you more information to help you develop an intervention by giving you all of the subdomains as well as the domain scores, and it also has that lower start point, that lower developmental age. For other cases, however, the domain level short form should be fine. The comprehensive form comes in 2 versions, with and without item level probes. What we mean by item level probes, it can be interview form where you can see in blue there is a little interview probe that's given to you. It's sort of a starter to help you get the conversation started. So you might use for question 4, for example, the probe to help start the conversation with the parent. What does Sally do when you point or look towards something? What about simple gestures like this one? And you shake your head no. So these are there to help you get the conversation around that particular topic started. There's also an appendix in the Vineland manual which gives you suggested interview questions and additional scoring criteria for the interview forms. Remember that when you are doing the interview and you're selecting a start point, these are not based on chronological age. They are always based on developmental age. This is different than doing an IQ test, for example, where chronological age is often used as a start point. If you have an 8-year-old who's developing their adaptive behavior as a typical 8-year-old, that would be fine, an 8-year-old start point. But if that 8-year-old is functioning more like a typical 5-year-old with relation to self-help skills, 5 years of age should be the start point that you use on the Vineland. Here's an example here of the arrow going across at item 45, which shows this is the start point based on the developmental age of 4 years plus. The comprehensive form does use basal and ceiling rules. So when you're doing the interview, based on your start point, the child needs to get a 4 consecutive score rating of 2. If the first 4 items you administer at that developmental age start point are not scored a 2, you need to work backwards until 4 consecutive scores of 2 are obtained. Once you have 4 consecutive scores of 0, you can stop that particular part of the interview and go on to the next section. The interview forms are scored using a 2, 1, or 0 criteria. A 2 can be considered mastery. The child is shown when it's needed and when it's appropriate, and the individual usually performs it without any help and without prompting. It may also be scored a 2 if the behavior is something that they did when they were younger, but they've outgrown it. For example, if the question was about riding a tricycle, and that's something that the child used to do, but now they're riding a bicycle, they've outgrown the tricycle, you would still rate tricycle as a 2. A 1 represents when the behavior is needed or is appropriate, the child is demonstrating the behavior. But they sometimes perform it without help or prompting, but sometimes they do need help and prompting to do the behavior. And a 0 is that the child never performs the behavior. They never perform it without help or prompting. And it may be that it's scored a 0 because they have not learned the behavior yet. It may be they're not physically able to perform it. It may be that in their particular setting they're not expected or even allowed to perform it, or that they choose not to perform that behavior. And those also would be examples of 0. For example, if a parent says, well, I haven't taught my child that behavior yet, but if I did teach them, I think that they could do it. Just because they think the child could do it if they taught it does not mean that you score at a 1 or a 2. If they haven't learned the behavior because they haven't been taught it yet, it would be considered a 0. Another example is if they're not allowed to do the behavior, it's also scored a 0. So for example, if the question is, can cross the street independently without help, that would be scored a 0 if the parent is not allowing that behavior to occur. On the Vineland 2, we had options of don't know or no opportunity, and these have been removed from the Vineland 3. But there is a new estimated item response option available for every item on all forms. So this is when a person is estimating whether they think the child can perform that particular behavior or not. So if the respondent has not actually observed the behavior, they can do an estimated score. The check if estimated box needs to be ticked if an estimation has occurred. Once the Vineland 3 is finished, what you will need to do is look at the percentage of estimated items in each section of the Vineland. If you find that more than 25% of the items have been estimated, you should question the validity of the responses. If there's less than 15% of items that are estimated, the validity should be fine and not compromised. If you find 15 to 25% of the items are estimated, you should interpret with caution, and anything more than 25% really compromises the clinical validity of the results and should not be interpreted. On the comprehensive interview form, you'll see that there is some coding. The coding there is to help you have that conversation around a particular topic. So for example, interview topic A is around beginning to eat. So we would start a conversation around, what does Sally do when you put some food in front of her mouth? Then we would go to the next item that has a similar topic, also coded as A. What about finger foods like small crackers or cookies or biscuits, and solid foods like cooked vegetables or chopped meat? So here these probes in blue are there to help you start the conversation with the parent, and by having that conversation you then rate a 2, a 1, or a 0. So items that have a similar topic coding are always asked together. In the maladaptive behavior, we use slightly different response options. 2 means that behavior is observed often, 1 sometimes, and 0 never. And there's also the check if estimated box. Now the shorter interview form is called the domain level interview form. There's 195 questions compared to 502 in the comprehensive form. However, in the domain level form, all questions are administered. There's no basal or ceiling rule. The domain level form does not include a start point by age, so all questions are given and answered. On the domain level form, there's no item coding per item because all of the areas are combined into a topic area for you. For example, interview topic A, which is around eating and drinking, are all combined here in one section. And you can see the interview probes are there as well. Tell me how Sally feeds herself at the table, how she drinks liquids, for example. What about using a regular glass or a cup? How does she use a spoon? What about using a table knife? So all of these are given as a particular topic cluster. And there is an appendix in the manual which gives you some suggested interview questions for the domain level as well. You can use the interview on paper forms, but also on Q Global. When you're administering the interview form from Q Global, you're simply reading the questions from the computer screen or from your iPad or tablet as opposed to the paper form. And what the Q Global software does is select the appropriate section to administer. It has built-in logic to help sequence the interview topics for you. It will keep track of any basal or ceiling items on the comprehensive form and determine when you should move on to a new form or onto a new section when the stopping item has been met. This is what a sample interview looks like on the Q Global platform. So here you would be reading from the computer screen or tablet as opposed to the paper form. You can see it's showing us what topic area we're talking about. It's giving us suggested questions to introduce the topic, like, tell me about Stella's friendships. You can see each item, tips for scoring each item, and if you'd like it to give you the interview probe suggestion, you can click on probe. If you need help understanding the scoring criteria for each item, you can click on scoring criteria for help with that. You can also see the check of estimated box is available on the screen as well. So moving on from the interview form, the questionnaire form includes the comprehensive parent and caregiver form and the shorter domain level parent caregiver form. There's also the two forms for the teacher as well. Now these shorter domain level forms do allow for shortened administration of the Vineland, which is good because adaptive behavior assessments can take a long time. The short domain level forms provide scores for all the domains, your communication domain score, your daily living skills score, socialization, motor skills, and maladaptive behavior. You also get the ABC, the adaptive behavior composite. What you don't get is the subdomains. The short forms can be administered online or paper, and the results that you get are sufficient to meet AAIDD and DSM-5 requirements for diagnosing intellectual disability. The domain forms consist of items that are drawn from the longer comprehensive forms. And as I mentioned earlier, there's no basal and ceiling rules on the domain level forms. Every item is administered. On the comprehensive questionnaires, the parent completes domain level forms, all items are completed, but on the comprehensive forms, there are basal and ceiling rules. So again, selecting the correct form is quite important on the Vineland. You need to think about the use of the results. If you're going to be using the results to link into some interventions, it's nice to have the more detailed information from the 9 subdomains. And if you're working with a child who's very, very low functioning, having the form that goes down as low as possible, like the comprehensive form, is probably the best option. The 2, 1, and 0 is also used within the questionnaire form, which is the form that the parent or teacher does on their own. Now, a nice way to use the Vineland 3 questionnaire is through the Q Global platform, which allows you to be completely green and digital, which means that you'll be either administering on a computer or a tablet from your own office or from the parent's home or through the internet via email. So when you email the link through Q Global to the parent or the teacher, they simply click on the link, answer all of the questions. They can use any type of tablet or even a smartphone or computer as long as there's internet connection. Once they have finished the Vineland 3, you'll receive an email letting you know that it has been completed. You simply log back into Q Global and then you can generate the report. If the parent's not able to complete the Vineland 3 in one session on the computer, they can do it in multiple sessions. The computer will keep track of where they left off. Once a Vineland is completed, there's a number of norm reference scores that are available. The adaptive behavior domains and the overall composite scores all have a mean of 100, and a standard deviation of 15. The range is from a low score of 20 all the way up to 140. There's also confidence intervals and percentile ranks available. Now, the adaptive behavior subdomains, which are on the comprehensive forms only, use what's called a V-scaled score. This has a normative mean of 15 and a standard deviation of 3. And it's important to keep in mind that this is different than the scaled scores used on other adaptive behavior measures and on your IQ scores. So a V-scaled score has a mean of 15. You also can get age equivalent scores and growth scale values, which is a new score for the Vineland, which is useful when you're readministering the Vineland over time to measure changes in adaptive behavior. In Maladaptive, we also get the V-scaled score for both internalizing and externalizing. The critical items don't give you an actual score, but they're reported at the item level. If you're hand scoring, all of the scores are presented on the score summary page, which is part of the record form. You can see here that each of the subdomains are listed here, with that mean going across of 15, with a high of 24 all the way down to a V-scaled score of 1. You can see that the domain and the ABC scores have a mean of 100 going across here on the form, and a low score all the way down to 20, which is lower than some other adaptive behavior measures. On the form, you can also do the supplemental analyses, which includes a strengths and weakness analysis and pairwise difference comparisons. And this can all be done by hand as well. Here we're looking at strengths and weaknesses at the domain level, strengths and weaknesses at the subdomain level, and then comparing index score to index score at the domain level or at the subdomain level as well. When using Q Global reporting, you won't be filling out those parts of the record form because that will be done for you by the computer. There aren't any CD or disk-based scoring software available for the Vineland 3 now. It's only through the online Q Global system. What you can enter into Q Global is the subdomain scores, the raw score for each area, or for a more detailed report, you can input the responses for every single item. This will result in tables, graphs, as well as a narrative text which describes the scores. If you're having multiple respondents, so for example a parent and a teacher, you can create what's called a multi-rater comparison report. You can also generate a progress monitoring report if you're reassessing the same person over time. From Q Global, the Vineland 3 reports have a nice color cover page. All of the scores are given to you in tables and graphs, and you can see this includes the standard score, the confidence interval that you've chosen, and it will give you the range. You can see the V-scaled score for each of the subdomains, but also plotted here on the graph. You can also see the strengths and weakness analysis is done for you at the domain and subdomain level. You can also see here for each domain or subdomain there's an age equivalent score given as well. Maladaptive behavior is also reported as a V-scaled score. The critical items are listed, any that have been endorsed as a 1 or a 2, and these are items that should be followed up immediately. There's also a pairwise difference comparison. This allows you to see if there are significant differences between the individual's adaptive behavior in different areas. For example, is there a significant difference between the individual's communication skills versus their daily living skills? And we can see here that the standard score in communication is a 92, but daily living is much lower, only a 79. And the computer analysis tells us that that 13-point difference is considered to be statistically significant, and the base rate shows us how often does that difference occur in the population. And you can see here it's more than 25%. There's also a summary of how many items have been estimated, and then a narrative report as well, describing all of the different areas assessed on the Vineland 3. If each individual response has been put in to the computer, Q Global can then generate for you an intervention guidance report. Q Global pricing can be seen here. The first two pricings is for administering and scoring and generating a report all online, so not using any paper forms. So $6.50 is the price for administering, scoring, and generating a report using the comprehensive online form. That can be done on your own computer, or that can be done via email. The short domain form, all on the computer, administration, scoring, and reporting, is $5. For those of you who want to administer the Vineland via paper pencil, but then score it on Q Global, there's an unlimited annual license for scoring paper forms. That's $67, and that allows you to score as many paper Vineland 3 forms as you need to for 12 months. It's unlimited. If you're having multiple responders for one student or child, you can generate what's called a multi-rater report, where you'll have a score summary showing you the respondents from the parent as well as the teacher in the same table. This is quite convenient and means that you don't have to go back and forth looking at two different reports. They're nicely shown just in two columns next to each other. Makes it easy to see any differences and also any similarities. The multi-rater report can also give you that same comparison at the item level when item levels are included. You can also generate a progress report if you've administered the Vineland 3 to a child and let's say 12 to 18 months has passed and you need to measure any change or growth. The progress report can show you the differences between the first assessment and the second assessment. You can also see any differences within item responses in the item level comparison part of the progress report. So we can see here that on item 19, the first testing, the child was not able to perform that behavior at all, whereas a year later, it's been mastered. It's now a 2. The intervention guidance is a very nice part of the Vineland 3 report. It's generated for the comprehensive forms, and the items in each subdomain are then identified with content areas. This helps you focus where the intervention effort should take place. What the computer can do is take each item within a subdomain and order the items according to increasing developmental sequence, so the easiest or lowest developmental behavior to the most difficult. It will then look at the scores on those particular items and prioritize them for intervention. For example, prioritizing items with a 0 or a 1 that should be the next behavior that the child masters, and these will be prioritized into the intervention. So here's a look at the intervention guidance. This is the domestic subdomain. The V-scaled score was a score of 8. This is looking at things like safety at home, cleaning up after oneself, preparing food, and household chores. And you can see here that the item scores are being analyzed and then developed into an intervention. Before we finalize today's webinar, just to look at the standardization of the Vineland 3 and a bit about the psychometrics as well. You can see here the norm sample is a very big norm sample. The interview form was tested for the norm collection on 2,560 interviewees. The parent questionnaire was based on 2,560 as well, and the teacher, 1,415. This totals 6,535 pieces of data collected to create the norm samples. Within the norm groups, including typically developing children, but also including children with autism, general developmental delay, emotional difficulties, intellectual disability, learning disabilities, speech and language impairment, and then other disability categories as well. So these clinical groups have been included in the norm sample as well. You can see here, for example, in the intellectual disability school age sample that the IQ ranges are represented 50 to 70 for mild, 35 to 49 for more moderate, and less than 35 for more severe and profound. There are also additional clinical studies in the Vineland 3 manual looking specifically at children who are on the autism spectrum, those who have hearing impairment, and those who are visually impaired as well. Here we have the internal consistency for the domains as well as the overall ABC, Adaptive Behavior Composite Score. And what you can see here is that they're all very high, ranging from 0.86 all the way up to a 0.99. And the internal consistency here is on the subdomains also very high. Here's our retest reliability for the domains and the overall ABC for both interview, parent, as well as teacher. And here's the same information, but at the subdomain level. And all of this information is available in the notes that you have, the PDF of the webinar today, as well as in the Vineland 3 manual. In the validity section of the manual, you'll also see some information about comparing Vineland 3 to other measures, for example, to the old Vineland 2, to the Bailey scales, and also to the ABAS 3. This can be found again in the validity section of the manual. So just wrapping up today, the Vineland has a long history, dates back to 1935, so decades and decades of research behind this adaptive behavior tool. It's probably the most researched measure of adaptive behavior and offers many options. So we have the interview form, parent form, teacher formats. These are all available in comprehensive or short domain level formats. There's online administration and paper administration options. So there's a lot of flexibility and a lot of choices and options we have about how we want to use the Vineland 3. And that can be based on how we need to use the Vineland 3. So one of the questions is, can Q Global be completed via the telephone? Working rurally can make it hard to do some face-to-face work. I don't know that it's been standardized using over-the-phone administration. One option when you're working rurally can be to use the Q Global remote online administration, which means that you're emailing the link to the parent or the teacher. If they have internet connection, this can be a good solution. But you could do the interview over the phone. It's probably not ideal. But if that's better than doing nothing at all, then that's probably a good option. And it's just something that you would certainly want to mention in your report. Another question is it $5 and $6.50 per Vineland? The $6.50 is to do the comprehensive form online. That includes the report generation. The $5 price was for the shorter domain level form. Another question about the normative data and whether it's from the U.S. It is a U.S. version. The U.S. version is what we use here in Australia and New Zealand. And also, there aren't any adaptive behavior measures that are here in Australia. They're all U.S. norms. The last question that we'll do today is based on who can administer the Vineland. And the Vineland can be administered by a variety of professionals. It's what we call a user level B, which means that it doesn't need to be a psychologist. It can be a counselor, a non-psychologist counselor. It could be a speech pathologist, an occupational therapist. It could be a special education teacher. So there's a variety of professions that can administer the Vineland. Thank you to everyone for attending today's presentation. I hope you were able to take away some valuable information about the Vineland 3 in this introduction. And I hope you enjoy the rest of your day.